Kawooya says the failure by medical workers to communicate clearly the drugs and how they're supposed to be used makes most patients fail to use them effectively, which worsens the sicknesses.
You prescribe a drug that even when you reach to the pharmacist himself is not conversant with the language you have written. And he's a medical practitioner. But you decide to write it the way you want, assuming that everybody. Now, how will the other one, the caretaker of the patient, reach home and start remembering? But if you wrote it clearly, the caretaker will read it that this is twice a day. You're right, BD now. Birthday, what?
According to Dr. Helen Biomiri Ndagije, the Director of Product Safety at National Drug Authority, in the last 5 years, they have received 10,000 of patients' complaints about different drugs that were prescribed to them by medical workers or those they have bought over the counter. She says the available figures are not representative enough because the country's reporting mechanism is still below the World Health Organization rate of reporting unsafe drugs, which should be at least 200 reports per 1 million inhabitants.
So according to Uganda, we have about 60 reports per million inhabitants. So it is not, we are not yet there. Much as we have these systems, we are saying 10,000. We have not yet there because you should be able to have systems to capture these events so that you can act on them.
Ndagije says that they have increased surveillance for drug safety through their pharmacovigilance arm, where they are creating awareness such that people report and appropriate checks are done on the particular medicines being reported. She says antibiotics and HIV drugs are the most reported drugs. She said that self-medication is one of the biggest problems. They are fighting in the bid to guarantee patient safety.
We are strengthening, and that's why now we are working with the Ministry of Health. We work with the pharmacy department here at the Ministry of Health. We work with different stakeholders, all healthcare professionals, and very many. There's quite a wide national system.
Dr. Bayo Fatumbi from the World Health Organization says the safety of patients begins with the safety of health providers who diagnose and treat diseases. He said it doesn't make sense for a doctor who prescribes drugs to use a name that is not familiar with patients, yet the same drug has a common and relatable name.
A name that is not well known, using a pharmacological or clinical name rather than call it the way it is. And that became a problem for that particular patient. May also or is so rest in perfect peace.
According to the research, out of 130 million people from low-middle income countries, 2.6 people die due to drug reactions. However, Regina Mariam, the head of Community Health and Information Network Chain, emphasized the need for civil education if such a number would reduce.
So it's important that the community, the patients, the family, the caretakers are all empowered so as to be able to understand the extent of the problem regarding medication safety, for them to know that whereas this medication can help me cure my ailment, but it can also lead to death.
Story compiled by Lubega Ibrahim Kasinga for CTV PM Edition.